Hello, hi, it's Dr. Erica. Thank you for joining me on this particular video. And this is a new video that I've uploaded, and I hope that you like, share, and subscribe to this channel. I'm Dr. Erica, founder and CEO of Millennium Pharmacy, which is my business since 2018. If you have not already subscribed, please do so that you can be in the know and have access to all of the latest content that I upload. Okay, so chemistry is what I'm talking about in this particular video. Relationships involve chemistry, interaction, balance between likes and dislikes, similarities, compromise, just being in the know of each other's expectations, desires, so forth. So chemistry is not only good for relationships, but it's also good for situationships, such as healthcare provider and patient interaction. This ultimately affects the patient's prognosis, outcome, end of life treatment, also their overall health and well-being. So we want to make sure that patients are aware that when they speak with their healthcare provider, that they develop in the beginning a good relationship, a relationship that can last and present a good effect for the patient overall. So that's what we want to do. Okay. And we also want to make sure that our healthcare provider knows everything about our history, our medical history, our personal life, what we're going through at different times, what we've faced, what we've overcome, things like that, because ultimately they can interpret all of that information and get to know you and understand how you may be feeling and how it will affect the disease state. There are disease states that do affect a patient's, and the patient affects the disease state. For example, diabetes, also hypertension, high cholesterol, kidney failure. All of those things are dependent upon the patient's safety and the patient's overall effects, and then also their interaction with the pharmacist and the nurse staff, as well as the physician. When you build relationships, you build loyalty and trust, and you also get to know each other and can confide in each other about different things. So that is the importance of building good chemistry. So when you're in a relationship, the most important thing is going to be what? Chemistry. You want to get to know each other. You want to know each other, and you want to have a relationship that's going to last. Okay? So, and that's for any relationship. A good lasting relationship is one that's going to last. Okay? One that is going to be effective, and one that can be mimicked easily by others who are also interested in being in a similar relationship. So we all want that in relationships, right? So when you're with your healthcare provider, do confide in your healthcare provider. It helps your prognosis and your overall well-being. You want to make sure there's an attraction. You want to make sure there's a sort of spirituality between the two of you. And then you want to also make sure that there's some sort of compromise as far as the medications that you're going to take, how you're going to take them, how it's affecting you adversely. You want to know those things. And you want to make sure there's a balance. You want to make sure you're balanced as far as your affirmation towards yourself and your healthcare provider. Also, you want to make sure that you are receiving the reciprocal. Okay, so you always want to make sure there's a healthy relationship that's going on between anyone in a relationship, especially healthcare provider and patient. So those are my tidbits for chemistry development between a healthcare provider and a patient, which is very essential and helps in the long run. So do be considerate of that. Also, binge watch on all of my videos, and I hope to see you on my next one. Okay, so take care. I'm Dr. Erica signing off. Bye-bye.